Again, we talked about this last week, and I kind of got beat up for this day. But you're going to have it anyway, so thank goodness that you may enjoy this even more than you enjoyed this is massage therapy. The more you read about and become more knowledgeable, you realize that when we went to medical school, we were taught that we were going to save a whole lot of people's lives, but many times there comes an endpoint that we cannot get beyond that. So we must look at other modalities, and some of the modalities may be better than we have learned or been taught from a traditional standpoint. I met Mr. Kim through friends. You meet people through friends, and the problem I had is that at one time my hip was somewhat not doing well. When I went and did my MRI, it says arthritis, like all people say. So I went to a chiropractor and got temporary relief, and I went to an osteopath and got some temporary relief. I went to an orthopod, and he says, I want to give you injections. Until I met Mr. Kim. Mr. Kim, I met him because he said, I can make, with my acupuncture, cartilage grow back into your hip. I said, that sounds really amazing. And he says, I've done a lot of things. I've cured breast cancer. I've done this. I've done that. That sounds amazing. So automatically, I reflected back into my old days of the television where you saw the acupuncturists in China doing acupuncture, and then they're having, cranial surgery and all that kind of stuff. So I was amazed. But beyond Kim, father developed KOSA acupuncture, which is a Korean acupuncture. And he's better at it than I, telling you about that whole history. But this is different than the acupuncture that they're used to, which is probably Chinese acupuncture. And what I really realized is that a lot of DOs have learned Korean acupuncture because there was a time that DOs had to travel all over to try to get extra expertise. That's really, after I thought about it, when you started talking to Dr. Evans, Dr. Evans' mentor was Brockington, and Brockington had gone to Korea to get Korean acupuncture. So, yes. So Beyond Kim is an expert in acupuncture. And he gives classes all over the world, and he'll tell you some of his stories, and he has done some wonderful things with acupuncture. I think it's absolutely great. It just hurts my heel. But I think it does things, and I have seen people come in as I looked at him, and he does his acupuncture, their pains are immediately relieved. Okay? Or they may be too afraid of needles. So without any further hesitation, I'm going to present to you Warren Kim, who is just an expert at this. I mean, what you guys are getting usually costs a lot of things. So he has come and decided he will give you guys some teaching. I don't know how long you're going to stay. I think he's going to try to present in an hour, and then you're going to try to do a little training in the other hour. And I think that I might just. The thing that I thought about one time was I wanted to find out, when you're talking about doing research, when you compare massage therapy to OMT, acupuncture, to traditional medicine, this is what we look at today. You understand? And is there a place that we can think about that as a way of seeing which one is better, which is worse? So we get an opportunity today to learn a little about acupuncture. How do people know about acupuncture? Anybody? You've done it?
Yes, actually with my preceptor.
Okay, good.
My last rotation.
Good. Who was that with?
Dr. Morrissey.
Okay.
Dr.
Okay. Okay. So this is at the highest level that you could go to. This is what he does for a living. And he has, and so if he's really good, he has these books. And guess what? They're not. But let's talk about it. So, Mr. Kim.
Thank you very much, Dr. Sealey. Good afternoon. I hope my presentation is interesting, and Hopefully you like it. My full first name is Byung-sun, and that's way too long for you to remember, so I'll make it very short. Byung, and last name is Kim, so you can call me Mr. Kim. And if you have any questions, please let me know. I can start so that I can answer your questions. And I'm very grateful for you to having me here and give you a presentation or the introduction to KOSA. KOSA is an acronym of Korean Orthodox Sa'am Acupuncture. And my father is one of the best, literally best of the best acupuncturists in the world. I learned that acupuncture from him in 2012, and I started teaching acupuncture to physicians and acupuncturists. Canada, United States, Argentina, and then like 78, something like that. And then last year I wrote a book so that everybody can learn and do it. The name of the book is Needleless Acupuncture. Well, the silver bullet. One of my patients put the name on this because she loved it so much. And with this, you don't even have to use needles. You just have to use magnets or mechanical pencil or car keys or fingers. And you can still deal with the various challenging diseases too, not just the pain. Okay, here you go. Everybody says that Chinese acupuncture, or TCM, which is an acronym of traditional Chinese medicine, is the best. But this is a true story. In 1093 AD, Korea dynasty gave a book, so-called Korean Acupuncture and Solution, to China, which was the Song dynasty. And then they wrote a book, Yellow Emperor's Inner Circle. They claim that book was based on the Korean book, and they claim it is been written about like 3,000 years ago. That is not true. So, in other words, Korea is the origin of the acupuncture. Like 400 years ago, an ascetic, his painting was Sa'am. About 400 years ago, he stayed in a cave for 13 years, and he invented a formula to make organs healthy from being deficient, excessive, cold, and or hot. In early 1950s, well, his book has been buried in the graveyard, so nobody knew how to do Sa'am's formulas. And Master Reed discovered those books in the graveyard and wrote 2 books and trained 100 apprentices. My father, Master Hyungwan Kim, was trained by Master Reed in 1962. The advance. My father has invented a special needling technique and named Sa'am acupuncture as a KOSA and wrote a book. And he has successfully treated diseases like arthritis, atopic dermatitis, asthma, Barrett's palsy, bleeding nose, bronchitis, throat cancer, middle ears infection, blah 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 blah. Just an end of endless different types of diseases. He has taught more than 800 acupuncturists, physicians, and ordinary people in lectures since 2003. One of his students, who is a physician, owns 2 hospitals in Germany and Austria. Wilhelm Clark, MD Wilhelm Clark. He learned the KOSA in 2003, and he taught KOSA to his physicians. And success rate was way better than 90%. Over 80,000 patients per year. Very next year. This is me. Actually, correct the typo, 2003. Since 2003, I have taught more than 70 physicians and acupuncturists in Argentina, Brazil, Canada, France, Germany, Indonesia, Spain, and US. And I'm the author of the book, The Silverbird KOSA, Needless Acupuncture. It has already been translated into Spanish. The gentleman is Madrid, Spain. And the other languages are being done, like Catalan, French, German, Indonesian, Portuguese, and Spanish. And they're all in their own countries. Okay. Did you see the video? That was talking about the fractal. That video was made using fractal theory. All the computer graphics, the wave of a big sea, and the snow avalanche, the river flows. When you see the cartoons, you see the lions have hairs waving. They're all using this map. Fractal geometry plays 2 roles. It is the geometry of a deterministic chaos, and it can also describe the geometry of the mountains, clouds, and galaxies. That's the, I don't know how to pronounce his name, but that is the gentleman found that in 1975. And further details is an irregular surface like that of a broken stone. The fractals are non-regular geometric shapes that have the same degree of non-regularity on all scales, just as a stone at the base of a foothill can resemble in miniature the mountain front, which it originally tumbled down. So fractals self-similar whether you view them from close up or very far away. Okay, this is I'm sorry. That's typical example of the fractal. The other one. The other one. So everything is fractal. Well, he found that or invented that theory in 1975 while the Oriental medicine has been using that theory for thousands of years of period of time. So what they believed was the cosmos consists of yin, yang, and 5 elements. Because we live in the cosmos, so our bodies consist of yin, yang, and 5 elements. This is a national flag of the Republic of Korea, or in other words, South Korea. At the center, that is the circle representing yin and yang. The blue one is located at the bottom, which means cold, low, dark, heavy, and the upper one is yang, which is light, bright, hot, that kind of stuff. So every single of us has a yin and yang. So what is yin and yang? That is just a relationship. Moon is yin, yang is sun, night is yin, yang is day. It's just a comparison. There is no definite yin, there is no definite yang. It is talking about just a relative. And 5 elements consist of wood, fire, earth, metal, and water. And somehow they figured out those organs. I'm just showing 10 organs over here. Like the wood at the top circle, the top one is a gallbladder, which means the yang side of a wood. And the bottom one says liver, which means inside of a wood element. So they are in a relationship with husband and wife. When you look at the right one, it says fire. So the outside one is a yang organ or fire organs, which is small intestine. And that one says heart, which is inside of fire organs. I don't know how they found it, but it works always as it is represented. And for example, also there are 2 relationships. The thick arrow means a forcer, and the starting point of the forcing arrow means that those 2 organs are parent or mother organs to the end of those organs located at the end of the arrow. So let's say on left kidney, the left circle, and the right one is the kidneys. Kidneys is the child of lungs. So if you have a lung weak, then mother cannot support or foster this child. What it is kidney. At the same time, like water can distinguish the fire. If kidney is just too strong or excessive, then it'll harm heart and or actually heart, because yin works on yin and yang works on yang. I'm sorry. this is just to give you an idea how the starting point of Oriental medicine. Everybody has 12 ordinary and 2 extraordinary meridians, and they consist of 361 acupuncture points on the body. So even though it is just a born baby, still has 361 points. I don't know how they found it. I believe it must have been aliens. It's just amazing how they found it. And when I use them, it always works. Never fails. So when you talk about, alternative medicine, or CAM, we always need to ask about the success rate. What was the success rate? Well, you must have heard the hidden cancer, even the final stage cancer will be healed by just praying. You have heard about it, right? Yeah. So, can everybody get healed by praying? No way. Maybe 1 out of a million. Then are you going to take it? No. But this one is totally different one. And each ordinary meridians have 2 meridians, left and right. That's all symmetrical. Actually, a few days ago, where's my book? I met an orthopedic surgeon, and we talked about my KOSA, and then he was asking me to treat his index finger. Okay? He had some accident, and he had a pain on his joint for 2 weeks. So I said, "Doctor, you have a large intestine is not healthy enough to fix the problem." Totally different concept, right? That is the path of meridian of a large intestine and acupuncture points of large intestine. So since index finger is a large intestine, so I told them, right here, this is the fire point of his large intestine. So when I use a needle, stuck in here and manipulate it, and you see the pain disappear. So I did it exactly as I explained, and the result was exactly as I explained. Never fail. This is a video of my acupuncture. Have you heard about this Bonghanda? Anybody? Okay, this is one of the amazing story. Bonghan Kim. This last name happens to Kim. 1/3 Korean has Kim last name. He was from 16 to I don't know when he died, but he was no Korean guy. Represented his thesis about Bonghanda and Living Act in 1961. This is very amazing and interesting story. Assemblies of tubular structures 30 to 100 micrometer wide. Red blood cells are 6 to 8 micrometer in diameter. And actually this was found by 2000, in the year 2007, the doctor saw one son. And Bone duct contains a flowing liquid that includes abundant hyaluronic acid, a substance that cushions and lubricates the joints, eyes, skin, and even heart valves. The bone duct is also being compared to fiber optic channels in the body. These ducts may be able to carry an extremely high density of information far beyond the limited one-way signals of the nerve system, or diffusive information carried by hormones in the bloodstream. So, Hong-Han Kim, Dr. Kim is the first person scientifically proven that there is a physically meridian exists. And this is talking about a living egg. There is something even before cells, and it circulates in bone ducts, controlling creation, aging, and the destruction of cells. He named it the living eggs. He also found that living cells flow through bone ducts and it differentiates into other cell types wherever a wounded part is located. Interesting. I'm not here to sell my book, but just to give us some idea. Okay. My book has all the treatments, how I fixed the problem. Okay. One day, it was at Mackie Tyson Airport in Tennessee. I was renting a vehicle, and it was very cold winter. It was like Detroit. And she was sneezing a lot. So I asked her to give her arm. And I pinched the water point over her lung because her lungs are not warm enough to evaporate the waters, right? So I pinched her water point on her lung. In 10 seconds, it's gone. Sneezing is gone. Stomachache. One of my readers last year, she got my, actually, no, this is not the one. I taught my acupuncture to a chemical engineer. I spent 2 hours. A few weeks later, he sent me an email saying, you know, I had a stomach pain, and I followed your procedure, and I fixed it myself, just pinching the 5 point of stomach. Knee arthritis. There was a Hispanic lady, like probably 60. She had both knee arthritis replacement, knee replacement. She was laboring with pain, and I could see her scar like feet long. And I used total of 6 magnets. The diameter of the magnet is like 1/8 inch. And I used to stand up from the chair. She was afraid because she knew what pain she's gonna get. Anyway, she stood up, found no pain. And I asked her to walk down the aisle without walker. She was reluctant to that too. But she tried, she was crying because the pain was gone. Migraine. One of my coworkers, she had a terrible migraine. For 4 days, she has been using 4 pours of dosage of over-the-counter drug. I pitched a 5 point on her gallbladder. You know what? Why gallbladder? Oh. Come on. Do you see? Gallbladder, a bunch of points where migraine can get. In a second, as soon as I let go my fingers off, it's gone. Never come back for months and months. I was tired. I keep asking, how are you today? How are you today? Okay. Peripheral vision. She was believed that she was born with peripheral vision. What it is she cannot see from side. She can only see 45 degrees and beyond. Well, she had the reason why she was seeing me was she had a bunch of pain all over her body. I was treating her and she all of a sudden she said, I can see. Just single treatment. Okay. The late 60s, the late teenage girl, she had a tumor in her center of her tongue. So she went to a physician and she got treatment with the laser cutting. But 2 months later, it came back on. The diameter was like 1/32 inch, and length was like 1/8 inch. I was on travel in Las Vegas, so I didn't have enough time. So I asked her to see 2 times a day. I see her first time, a second time, and third time when she came in, what she says is, you know what? I was licking the ice cream, and I saw the blood on the ice cream. So I looked at the beer. It's gone. Until 3 years now, later now. Never happened. Okay? Impaired hearing. Impaired hearing never comes improved, right? That's what you've been taught. That is not true. I mean, not always true. I had a coworker, he had that problem. So I stick a magnet on his fire point of his kidneys because we believe the kidney is in charge of hearing. Next day morning, he found that he was having TV volume too loud, and he had to lower the volume. Okay. Spinal curvature. Well, Larissa just like 30 minutes ago, she told about the emotion. So, well, her right ear was kind of stuck out, like 3 lips, if I remember correctly. But her spinal is just fine. And all the other lips were symmetrical, beautiful. But only 3 lips on her right. They found it very recently. It was like 5 or 6 years old. So I gave her treatment, and I was giving some information to her mother. She needs to do this, she needs to do that, she cannot do this. And one of them, when I was talking about horror movies, she says, oh my God, my daughter's most favorite movies, novels, are all horror movies. So I told her, horror movies, I mean, getting frightened, afraid, surprised, they all harm kidneys. And kidneys in charge of the bones. So we need to feel it right away. So she did it. Guess what happened? I gave her probably 3 treatments at the most, once a week. And about a month or 2 months later, her hip got back to normal. So emotion affects, of course, organs, and organs affect emotion as well. Bicep cut. This is another amazing story. This is not what I did, but my brother. There was a gentleman. He couldn't rotate his wrist because the bicep was cut. There was no remedy, as you know. And my son was treating him because he had abdominal pain. And my brother was thinking, I may be able to fix this too. A stupid idea, right? Totally outrageous idea. And next day morning, he was wearing his shirt. I found he was able to rotate. For the first time over 30 years. It's just amazing, amazing. So we believe there is something, the meridian is working far beyond just muscle, tendon, bone, whatever. That's what we do. Other than that, there is no way I can explain. The pain, this is our interpretation of pain. Pain is the very important advanced guide to program our lives, so that asking us to do something to cure or heal ourselves, or by any means. So what most of the people think the pain has to be, like arthritis, has to be heated up or warmed up so that you have a better circulation. But to me, no way, because all the pain is due to the heat, and the final form of energy is always heat. Right? When you rub against it, do something, the final energy form is the heat, and it's going to hurt. And eventually, when you get the physical therapy every day, you feel great about 2 hours because there is better circulation. However, it actually was hurting the part. So I usually recommend not to do any physical therapy, even exercise, because when you have arthritis, when you move, you feel the pain. That means your organ is asking you not to move further, because I cannot handle it anymore. That's what it says, and that is what is asking the owner not to move anymore. It's a totally different approach, right? It's just 30 minutes. Okay, cut on the big toe while moving freezer. That happened to me, and I was the victim of that incident. And I did it. I treated myself. What happened was I was moving freezer, and I was stupid enough to cut it, like probably ½ inch and 1/16 inches deep. It was pretty bad. So one of my friends says, "You need to go to the ER to stitch." No, I don't go. It was bleeding, of course. So I went back to the room and found the needle, and I found the point and stuck the needle on my hand. Actually, I was supposed to do something else, but excuse me. I did it, and like 10 seconds later, bleeding stopped. The pain started to getting decreased. That's it. I said $50 copay. Okay, next one. Burgers disease, that is, yeah, we can treat that Burgers disease with very, very high success rate. I cannot tell 100%, but better than 95%. Dyslexia was my case. The 4th grade elementary school boy, his reading was like this, jumping around all over the place on a single page. He cannot finish a single page reading, even though he has a weak reading. I gave him 3 months, and I gave him my son's book and asked him to try. Boom, 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 boom. Single treatment. Few months later, his father came to me. Can you give him another treatment? So I thought, The dyslexia came back. So I asked him, did he come back? I was surprised. He said, no, I wanted him to read faster. So I said, yeah, I can do it. Because I can do it. You don't believe it, man? Okay, I had a patient, okay, who is kind of what do you call it, crazy about playing golf. And he had a shoulder pain. So I was giving him a treatment, and then I said, you know, this weekend when you go out play, your distance will be increased and your accuracy will be increased. That's what I'm talking on Monday. You were right. Yeah, it affects your brain. You can get more concentrate on what you're doing. That kind of stuff. Injuries, as a matter of fact, the treating injuries is just a piece of cake. We can, maybe you think I'm so cocky, but once I know what I'm doing, then there's no way I cannot be cocky. Because I know what's going to happen when I treat. Any volunteers? Okay, come on, please.
Oh, I'll call you.
Okay.
I'll call you.
What's the problem? Here? Stop. Right. We always treat others. Stop.
Yes.
I don't know. I don't know. You there? Well. Please understand, this is not someone's face. It's like this.
Kim,
Yes.
can you, as you doing it, can you tell them what you're thinking about and how you're treating? Because they're watching you, but they can't visualize. I know because I've been there.
There. That's our small intestine. It happens to be fire organ. And if it is involved, do you think it involves the muscle? Okay, then it's your liver. So I'm gonna have to do something on the liver. So
the women, when they have the PMS, cramps, that kind of stuff, that's all liver.
Does everybody understand what he's talking about when he says that? I think it's.
I don't know. I'm sorry? Really? What did you use? Well, liver happens to have a branch meridian to the lung, so that may affect you. And also, lung, it involves the muscle too, right? Without muscle, you cannot move.
Huh? It's not hurting. Second. That hurt. I scared you. This is something about chicken. Come on. No, I love to eat chicken.
And somehow, somehow, you get treatment. Something wrong. Your liver. The second one, you have to anyone? Oh, please.
Did you get better? Are you serious, Angel? So you felt better?
No, she's my daughter's daughter.
Huh?
No, I was just. Oh yeah. What was it again? Upper. Well, again, muscle is muscle, tendon, ligament, that kind of stuff. That's muscle. What I'm doing is 5.4 liters. Okay, ringing ears, there are 4 organs to work. If it is, if it is high pitched noise, that happens to be kidney. If there is a kind of phonetic noise, it is kind of, there are 2 more. Gallbladder, small intestine. Well, anyway, 4 organs. So high pitched. That is a very, very challenging for time-consuming work. Of course. The ringing goes. Ring it. Still there. Even my own muscle. elbows out. Better? More better.
He did not pick yet. No, really.
Kim, was Betty supposed to come?
I'm sorry?
Was Betty supposed to come?
Yes, she was. I don't know why. Okay, I'll give you 2 minutes of video. Okay, this video was recorded this morning when I was treating her. And I met her like 2 weeks ago. She is with a lung cancer on her right, stage 4. And she also has cancer on her left breast. And when I saw her first time, she had a kidney stone too. Her urination was fully with the blood. She couldn't take care of pain, even though she was taking all the painkillers. Okay, and she wasn't able to eat or even drink for 2 weeks. She didn't have a bowel movement for 2 weeks. That was the last, like 10 days ago. And I gave her when I gave her the first treatment, when she was able to sit on the chair only for 10 minutes because of pain, if it is longer than 10 minutes, she was able to sit for 3 hours without any pain, no painkiller whatsoever. And also, she was able to eat. Next morning, she had a bowel movement. And she didn't have nausea at all. And unfortunately, she ate too much because she was starving for 2 weeks, And there was some problem because of her financial status. She couldn't see me. Well, last Saturday, I was called at 9 p.m. and her temperature was 100.8 degrees. And if it is exceeds 101, all day long, she was in fever that bad. If it is 101, then they were going to go to ER to take treatment. And I took that down there. I started treating her Saturday evening at 10. And then 24 minutes later, she couldn't, by that time, she couldn't even drink a sip of water. Because of nausea, she had to throw up immediately. And 24 minutes later, she was able to sit, and the pain or abdomen is getting decreased. 2 hours later, temperature began dropping to 100 something. And 4 hours later, 2:30 in the morning, she didn't have no pain or whatsoever. She was able to drink water as much as she wanted. And this is her testimonial. She wasn't ready. Actually, I wasn't even thinking of this video recording.
Hi, my name is Donna. I'm 62 years old. I've been diagnosed with stage 4 lung cancer and cancer in my left breast, which has led to a lot of pain. And 2 weeks ago, my daughter told me about someone she had heard about that does acupuncture, and thought maybe he could possibly help me. And I asked her to call him. And today is my 6th treatment, and he's helped me tremendously. He came to see me Saturday evening after I had run a 100.8 temperature all day. Couldn't hold anything down, vomited the entire day, was in terrible pain in my abdomen. And within 2 hours, he had me pain-free, and I slept through the night. I was able to eat the next day, hold down my food. Every day that I see him, he helps me more. This treatment has been very beneficial, and I don't know how I could make it without it. I definitely would recommend that people use this as an alternative to the pain pills, because I've been able to stop taking the pain pills and use this instead, because there's so many side effects that come with the pain pills. The nausea, the vomiting, the constipation, and this being all natural, it's much better. Thank you, doctor, for all you've done.
I'm not a doctor, I'm just an acupuncturist.
Okay.
I am just an acupuncturist. Well, I was gonna do some research. The topic is regenerative cartilages of bone-on-bone arthritis patients with 93 months. Any questions? Well, okay, this is Sealey. Everybody has different response, different status of their organs. Dr. Sealey may be able to give you some testimonial on his treatment. Would you please?
Do I have to?
Please.
Well, I don't want to really prejudice anybody, but I did have some arthritis, as I told you before, and we were in the beginning. Kim wanted to have a study, that is, take 10 people that had bone on bone, and that's what my MRI said, and start giving acupuncture and see how they did. So when I started my acupuncture, I don't know whether you guys have seen me before, but I usually would come up pretty readily with the arthritis. And over the course of time that I've had the treatments, and we treated every day, I got steady improvement. And I haven't done my MRI again, but I think that I'm kind of curious to see what it's going to be. The problem that what I have is that it's an everyday process. It's like you want to do it every single day. So as a clinician, and Kim being an acupuncturist, I think, and I'm just trying to see, I'm can't wait to be a part of the research project where we try to compare acupuncture with traditional medicine, because I think that we're going to see some different things happen. And I thought about it for a long time. I didn't know whether or not we could possibly, as a class, do some of the same kind of stuff. And that is that, as you see, I think that some of this stuff really works. It's just that we haven't really done the research on it as it is. So I'm a believer in it. And I think that the people that he treated today probably will, for that temporary time. I mean, I've seen a lot of things happen with this. But I don't want to really prejudice that, because I'm not trying to sell his acupuncture. He can do it. I'm just, as one of his patients, giving my impression of it and my experience. Now, I think that he's going to bring a young lady up in a minute who can do a better job of testimony, because she's not a part of this class. So, I know you guys think that you don't say the right thing and laugh and all that kind of stuff. You want me to get crazy. I don't want to. But I think, Kim, can you open the class up for questions now, and then when she comes, you can
Yes, sir.
continue, and I have asked him to do two things. One was to give you an overview of acupuncture. And this is Korean acupuncture. And the second portion of it is to sort of kind of see whether there is any interest in him teaching some of us how to do it, which would be amazing to learn as a student and go on with that whole process. So, I mean, I got him over the barrel now because he really haven't heard me say this before. But it would be great if he would, do that. So the second half of this was actually going through and let somebody, see what he does and how he go through some of the things in his book. So at that point, to be honest with you, after you have your demonstration come, I'm going to let the people that really are not interested in any more of this go, because I think you've been here long enough. And those that are really interested, stay around for a little while. You'll stay around for a little while with them once you
Sure.
yeah, so I think that's what we have to do.
Okay, to answer the question again. Actually, the lady was supposed to come in at 3:30. She had a severe problem. She was diagnosed with severe arthritis, and she was also recommended for hip replacement surgery. And she had, when I look at my chart, I believe at least 2 dozen different symptoms. She can hold the urine, she needs to wake up 2 or 3 or even 4 times a night to urinate. That is the urination during sleep or waking up due to urination. That is to us, that's a disease. That has to be fixed. Well, she had 2 treatments, and when I was given the second treatment, asked her, "Can you see better?" Because she told me she has bifocal lenses, wear all the time, and very poor night vision. She says, "You know what? I think I can see better." And since that day, she is not wearing glasses anymore. I was treating her arthritis. Well, I believe because I treated her for heart. Heart is directly related to the eyes. And also, liver is in charge of the eyes too. So when I treat both, while treating arthritis, you will have to be healthy. But now, not all can enjoy that kind of privilege because everybody has different things. So, if you ask me, can you treat this one? Yeah, very close to 100% success rate. But there is no guarantee. If there is no guarantee, I can do it. Right? But that close. So, actually, my brother had treated an 85 years old lady who had arthritis. And in the 45 treatments later, when she took X-ray again, the cutting is gone back. So, is it gonna happen again? Well, pretty much always it will happen. It's just one year. Any other questions, please? Sure.
If you find that you're treating someone for a long time and you know exactly which points that you like to treat them on, do you ever use tattooing to ensure that they have those spots kind of mapped out forever in case they need to undergo treatment?
I'm sorry, I did not understand.
So if you decide the spots that you use to treat someone chronically, and you know that they'll need those treatments for years, do you ever use tattooing?
No, never.
Radiotherapy to mark the spot?
No, we don't do that. I don't have a tattooing license.
Do you ever find yourself not being able to treat someone and then you refer them to a doctor? Or
Well, I like that question. I usually depend on the diagnosis, blood set, test result given to me from physicians, not directly from physicians, from patients, because you heard about the wheezy week, right? You know what that is? The Bill Gates catchphrase. Then he found invented, or I'm not sure if he did it or Apple did it. However, when they come up with the Windows application or OS, what he was saying is Wheezy Week, which is an acronym of what you see is what you get. Okay. So to me, the Western medicine is Wheezy Week. You need to see visually, but we cannot see visually. We just diagnose, hearing the complaints, and do the palpation method to diagnose, checking your pulses, how fast. To us, heart rate is very, very important. It's very good indication of being of the temperature of our body's movement. Okay. 72 is supposed to be healthy heart rate. So 72 is a minute. And if it is 80 or above, then he has a heat. So you need to bring the temperature down. Of the organs, not the body temperature. That's what I'm talking about. And if the heart rate is 60 or below, then he or she is cold. So you need to heat it up. Actually, we can do that. So I think Western medicine used to see meet with the Oriental medicine, and the Oriental medicine used to meet with the Western medicine. Is it fair enough?
yes.
Thank you. Any other questions? Yes.
Early on, is it a specific injury with each person or any type of arthritis?
Okay. When I teach or provide travel around to provide one-on-one training, they love to ask me questions. What kind of patients do you see? My simple questions, I don't care. Any patients, any type. As a matter of fact, I may be going too much, but in 2 months, the lady of the video clip, I want to see the whole casket here. That's my goal. With the 60 treatment. Because my father, one of his friends had Asperger's cancer, and his was totally blocked in the tumor. There was no way he can swallow water, not even a single drop. So he was hospitalized, and the doctors, they spent hours and hours to tune in to feed liquidized food to his stomach. My father saw him in the tube in his mouth, and we always carry needles. My work, you don't want to see my work, right? So he pulled out a needle and stuck a needle on his fire point on his stomach. He did it. I just did to do to people like 5 minutes. Then asked him to drink of water. He was afraid because he's going to throw up. But he insisted, and he ended up drinking water. That's it. 5 minutes later, he was just fine. They did it again, a minute, for a minute. And then asked him to drink grape juice with grapes. Drink it, no problem. Next day morning, when he got back in, pulse was taken out. He ate regular breakfast provided by hospital and 3 more potatoes. And then he woke up without suffering or even radiation. Is it gonna happen again? Yes. Almost again. Any other questions? Sorry, so yes. Yes. Well, that's a good question. Brilliant. Actually, okay. Wood, fire, or sorry for my poor pronunciation. Metal and water. The water has 2 organs, yin and yang, which is kidneys and bladder. Okay? As a matter of fact, 1 or 2 of those organs are in charge of bone. Whether it is located here or big toe or thumb, it doesn't matter. All the bones are controlled by kidneys and or bladder. So, again, the orthopedic surgeon I was talking about, the index finger, that's large intestine, and also including cartilages, the joint and bone is in charge of the under control of the kidneys and bladder. So if I treat 3 organs at the same time, you must, well, you be very close to 2 months fix, minute or 2. So we use organs function, and so this functionality I'm talking about is some of them very same as Western medicine thing, and also we have different function of those organs. As I said, the ringing noise usually, if it is high pitch, that's kidney. And hearing impaired, that is kidney, that kind of stuff. So kidney is not just for kidney. And even we think a total different. Even drinking water, I recommend my patients not to drink water because usually many patients of mine have kidney problems. Kidneys is just a filter, isn't it? So we have a limited capacity filtering. So when you pour river on a small size of filter, what happens? Kidney is going to fail. That's the reason why I'm asking them not to drink any liquid form 1 hour before meal, during meal, 2 hours after meal, or 3.5 hours. Even doing that, you can lose your weight because your stomach can be probably better. Okay? And everything will be better because kidney will have less burden. Next question, please. Just different concept, approach. Yes.
Can you tell them some of the interesting things you're treating now?
Most of them are arthritis and don't see any, I don't think of any other type, but still, even though it is TB, bad thing, well, you have seen the lung cancer patient, right? So,
How about the blind?
oh, thank you. This gentleman is mid of 50s, and he is diabetic, and he has been pretty much blind for 3 years. Okay. Even though he sees this door, he can only see that kind of frame. Oh, this is the brighter, this is darker. That was his stage. And I do have a special treatment for eyes. That's for vision. Pretty much how many people? 1, 2, 3, 4, 5, 6, 7. 7 people. You don't have to wear glasses anymore. I can do it. So not just talking about the vision, but also all the disease related to eyeballs I can treat as well. That's another specialty in my actually, that's it. Anyway, and well, when I gave him 6 to 3 months, he says, yes, it was 6 to 3 months. About the second or third 3 months, he said, you know, Mr. Kim, my left eye have a very narrow field of vision. Now I can see why. And next day he says, you know what? I can see some things not brighter than before. And 3 months later or something like that. And he says, you know what? I used to spill the coffee cup all the time because I couldn't see. And the coffee is hot. It's very dangerous to dip his finger in the coffee. And he says, I can see coffee in the coffee. Next day he says, you know what? I was able to see the grouting on the floor in his toilet room. So it's getting better. Hopefully in 2 months you see. And please let me introduce. I don't want to read her name here. She had.
Betty, give it to me. It's one of these young
She
people
was
that figure it out.
diagnosed with hip arthritis. She has been being treated like 17 times by me by Acupuncture. She can give you some testimonial on her treatment and impression, perception, whatever. Thank you for coming in.
Good afternoon. My name is Betty Petrens, and I work with Congressman John Conyers, so I'm always running, especially at campaign time. And during campaign, I was so sore and so stiff that I could hardly move. I met the guy 2011, and I had a shoulder pain, and he did some magnets, and so it was okay for a couple of days. And then he went away, of course. And so when I found out he was back, I had 2 surgeons, orthopedic surgeons, standing by to give me hip surgery. One was at Crittenden Hospital, the other one is at Henry Ford's. And I could not get out of bed by myself. My husband had to pull a rope. I have an easy chair because some mornings I would wake up and my leg didn't work at all, and I would just fall into the chair. And then they gave me a cane. I just turned 64. I don't work yet, hopefully, but I didn't want to walk around with a cane. So I found, so I finally made up my mind that I was going to have a surgery. And then Olivia called, says, you remember Beyond is coming back. So I held off. I was supposed to have surgery March 1st. And so I held off, and I went to see him in, I went to see him in 2 weeks prior to that, in February. And he gave me a treatment. And the first treatment, I said, oh, okay. The second treatment, I didn't have a whole lot of pain. The third treatment, I woke up and he goes, oh, I can get out of bed, I can move. If you recall that movie where the lady kidnapped the writer and banged his legs, that's how my legs felt every morning, except for it felt like somebody was sawing it and putting sawed in it, along with the bang, bang, bangs. So everybody kept saying, get the hip replacement, get the hip replacement. So the third day, I went to him and I said, oh, I feel good. So the fourth day, I was feeling a little better. And then I said, in order to get, I'll take you back, in order to get my hip replacement, I had to get an MRI. And they didn't want to give me an MRI because I have a pellet, a shotgun pellet, right by my eye. That happened when I was in the 20s, walking down the street over on the east side by my mom's house. So that's been in there for all these years. So they said it's too close to your eye, it's going to suck your eyeball out. So I decided to go in, have surgery at Creighton. They went in through my mouth. And when I woke up, I was this big. And the doctor told my husband, we couldn't get it. It's been in there too long. My husband was mad. I looked like a monster. And I had to go to work looking like this. And so he told me, you're not going to have any fillings in your face. You might never have any fillings up under your eye. So I think it was the third or fourth time I was at the eye. I woke up that morning, my mouth had all this yucky stuff, and my tooth was bleeding, and I rinsed it out, and then it was like this, a big old lump all day, and it kept draining. And I said, maybe I should make a dentist appointment. And the eye said, well, my treatment is helping you. And I was reading something that I had brought to him, and I said, oh, I can read without my bifocals. And I wear my bifocals since I was 42. As soon as you get in your 40s, young people, they want you to have bifocals. So I stopped wearing my bifocals, and I've been practicing every day to not wear them. I find after about 5 or 6 hours, if I'm doing a lot of paperwork, I might stick them on for a few minutes, then I feel guilty and take them right off. And besides my hip, I mean, I couldn't do this. I went to a gynecologist every January. I have my pap smear and stuff, and I couldn't get my legs in a stirrup. I could not move my leg out like this. I could not do my leg like that. And everyone says, oh, you're giving this man too much credit. That's in your mind, your imagination, and I know the pain that I was having. So it was not my imagination, it was actually this treatment. My hand would shake. I work for the congressman and I have to go to do a presentation. My hands would shake like this. I have to do like this to hold it. My grandfather's hand shook, my mother's hand shook. They tested us for Parkinson's and something else, I don't know. But since I've been seeing beyond, the only time my hand shakes is when I get really, really upset. It shakes a little bit, but not like this, embarrassing. So between my eyesight, my hand shaking, my hip, I think it's fantastic. And I go around recommending it to everybody. And so my brother has lung cancer. I'm trying to get him to see beyond now. And he says, oh, that sounds like magic. He's getting radiation chemo. So his wife told me the other night that starting next week, she's going to bring him to see again. So we're going to see what happens. But I think it was fantastic. My eyes, my hand shaking, my hip. Oh, the skin. He says, oh, you're pretty ashy. I says, yeah. I've been, I'm dark skinned. And if you don't put Vaseline or baby oil, you're ashy. And he told me to stop. And I didn't want to, because as soon as you get out of the shower, I squirt all the baby oil all over me and put the Vaseline. He says, you're putting chemicals into your body. And that's the same thing another doctor had told me about the chemicals. And so I stopped doing the chemicals. Every now and then I see a little ash. But the amazing thing is right up here. Ladies, when you get older, you get these wrinkles here beyond your breasts. And when you're old and you wear a push-up bra, it don't look pretty. So I looked in the mirror and it was smooth. I said, wait a minute. I'm looking, I said, no, that can't be. And it's actually a smoothing out here. And so I think all the doctors should practice. It's a little painful, little bit, but I also had moles on my face years ago, and they would stick me to zap off the moles. And so I would tell them, no, don't stick me, just zap off the moles. And so that's what it feels like, a little sting, and then it's gone. And everyone says that, I'm just overjoyed that I feel good. So, and I give it all credit to the us. And there's some more things that went on, but I can't even, I wrote them down. Can I look? I don't have my bifocals on, so and it's dark in here. What else did I wrote some things that he did. The nauseous. Oh, I can see that from here. When I first got there, he says, oh, do you have problems with your stomach? That was the first or second day. I don't have any problems with my stomach. What was he talking about? But I noticed I've been holding my stomach every morning when I get up, and I feel nauseous. And then I had irregular bowels. They told me I had irregular bowel syndrome. And they told me at the University of Michigan. And they did a laparoscopic because I was having bowel problems a couple years back. So when he told me I was having problems, he says, that's your bladder or your stomach. And I said, That was when I first went to him. I goes, how can you tell all these things? And then after a while, my stomach started feeling better. And not only did I go to the bathroom in the morning, I would go to the bathroom after lunch and sometimes at night. And I goes, I didn't know that was possible. You hear Dr. Oz always saying you should have 2 to 3 bowel movements a day. But that wasn't happening for me until I started seeing him. And now, but I gained 3 pounds. And I told him if I don't lose those 3 pounds, it's for him, getting him. But, and I wrote down some more. Oh, I went to the chiropractor for 7 years. Dr. Packard, he's a fantastic chiropractor. Sometimes I get this knot right up here. They wanted to give me surgery for rotator's cuff. So I went to Dr. Bob for 7 years and I refused to get that. And he says, I'll treat you for that. I goes, okay. I'm still learning all these things. I says, okay. And he treated me and it went down. I have not had any lumps here, any pains. And I think it's fantastic. And I could see it's almost like magic. And I feel wonderful. And that's
Yeah.
Yes.
I'm sorry. I gotta cut it and allow the students that want to leave to leave because
Sure.
I've kept them over the time, and those that want to stay and hear more, can stay, but I think the ones that need to leave,
Sure.
yeah.
Well, thank you
I
very
hope
much.
Yeah.